So, yes, let's start. Today, our topic to be discussed is headache. So, we all have gone through this phase of thing in our life, right? So, everyone has headache. Once in lifetime, they have had many episodes of headache. So, why are we discussing it today and why we need to understand what exactly is headache? So, that's the topic for today. So, as we know, headache is just a symptom. It's not a diagnosis. Okay. So we know headache is just a diagnosis, just like fever. Fever is just like it's just like a symptom of a pre-existing condition or a disease or an infection. Just like that, headache is also a symptom of a condition or a disease or an infection. Okay. Um, it's said that more than 50 to 75% of the world's population has gone through headache or has headache. So So we will discuss in detail a little bit about what types of headache is there, why we should be careful about it, what are the warning points to be noted, all these things. Now we know that headache is just a symptom. We have to know few questions and answers which we can be discussed here today. Okay. Uh, now, when do we have to go to a doctor and we have to get the checkup done? That's the first question that we always have our patients ask these questions, and we have been explained to them. So, when do you go to a doctor? When you know your headache is constant, progressive, not better with medications, you feel tolerating this kind of pain every day is actually making you depressed, increasing your anxiety, then yes, you need to have a medical checkup done with a neurological examination. Okay. Now, another frequently asked question is like, what kind of headache do I have? Uh, should it be treated? What should I do? All these things. For this to be understood, we need to know there is lot of kinds of headache. Actually, there is more than 150 kind of headaches, and we cannot discuss it all in detail. So we'll discuss the basic and the important ones today. Okay. There is two kinds, which is primary and secondary. The primary kind of headache is as a result of, it's not as a result of any medical condition. For example, this is cluster headache, tension headache, migraine headache, so and so. Where secondary headache is a part or a symptom of a medical condition which is existing in your body. For example, high BP, diabetes, high blood sugar level. Maybe it's because of any vascular conditions like stroke or any blocks in the brain. Sometimes a part of infection, medical or medicine overuse. Sometimes it can even happen after, as a side effect of any medications. Sinusitis, trauma after a fall or a hit on the head, some kind of tumors, etc. So let's go a bit detail into primary kind of headache. Before that, we'll discuss a little bit of the frequently asked questions and all these things. So we get a lot of patients with migraine headache. Now we they ask like, is migraine headache hereditary? Can it pass on to our kids? All these things. Actually, the answer is yes. If a parent is having migraine attack or migraine, their kids are four times more prone to get headaches. And if a child is having headache, any one of the parent might have migraine headache. So it can pass hereditary. Another frequently asked question is, can headache be triggered with any environmental factors? Yes. Weather change, any food items like caffeine, cheese, milk items, some kind of fermented food, alcohol. As an effect of lot of alcohol intake, you can have a headache. Some kind of chocolates, some kind of food actually, and even if you're allergic to any kind of dust, if the allergy increases, you can have a headache. Exposure to allergens, what we say, and some kind of strong perfumes can actually induce headache, and even passive smoking. Okay. uh, and now Let's go a bit into the primary kind of headache. Let's start with migraine attack, migraine headache, which is very commonly heard. We hear from our colleagues and friends and families that I have a migraine, I'm going through a very bad headache, and so and so. So, how do I understand you have a migraine, and when should you go to a doctor and all those things? So, migraine is the second most common kind of headache. Okay, and it is moderate to severe kind of headache. You most probably have this nausea, vomiting associated with it. You feel like you cannot see light, you cannot hear any noise. You have some abdominal symptoms which is associated with it. You feel the headache is very strong and it's on one side of your head sometimes, they say. And most probably it is not really responding to medications, like it lasts for actually 4 hours to 3 days even. So you know that the migraine is very frequent, and you're not recovering with the basic medications like paracetamol. Then yes, you need to go to a doctor for a long term medication maybe, and you need to figure it out. Okay. And another kind of headache, what we hear very commonly is tension headache. Tension headache is consistent, like it's there for the whole day. So we most probably the patients say that the pain is usually mild to moderate, and that they say it's consistent. It's there for the whole day. It's on both side of the head, and it's like a band like tightness over your head. And sometimes you even have a dull aching pain on your neck as well. And mostly it responds to medications fast. And you feel that the headache increases when you climb stairs and you bend and you do any physical activity more. You feel the headache has increased. Now, cluster headache is one of the severe kind of headache. It's the pain is actually moderate to severe. As the name itself mentions, it's cluster, means it comes like 1 to 8 times a day. A strong, severe kind of pain. It's most commonly seen on one side of the eye or behind the eye. You feel it on one side, and every time you have on the same side, mostly it lasts like weeks, 2 weeks to 3 months, and then it goes off for weeks, months, and years, and then you get it again. This is how you understand you have a cluster kind of headache. The pain is very intense and it's burning, stabbing like, and it's located, as I mentioned, it's located on the one side of the eye or behind an eye, all these things. Okay, now another kind is newly diagnosed or new daily persistent headache. They, as the name itself says, it's new, that the patient gets it for the first time and they're not constantly having headache. It just comes it just comes headache, and then it lasts more than it lasts for weeks to months, like 3 months. And then it responds to medications fast. And pain is constant, persistent without easing, but responds to medications really well. And it is located on both side of the headache. I mean, both side of the head. That's how you know that you have a new persistent kind of headache. That's the basic about a few kind of headaches in primary. Another in the secondary, there's it's very wide, and we need not to hear about a lot about the secondary kind of headache. But then, what in secondary that we hear very often, and the patients do have a lot, is sinus kind of headache. What we say is sinusitis or sinus headache. We all know there is sinuses on our face, and the sinuses are either inflamed, and then there is infection in the sinuses. So it's completely blocked and you have headache. So the headache is like mild to moderate. And what happens is, like, you most probably have a constant pain on the cheekbone, on the forehead, so and so. And then Some people say they even feel like swelling on the face. Sometimes they say there is a post nasal drip, like when you eat, and there's some kind of sputum or mucus coming in the back of your throat, and it can be associated with fever, not very often, and there's a bad taste in your mouth, and you sometimes even feel fullness in your ears. It can usually get confused with migraine headache. So, in this cases, you need to go to a doctor to differentiate, because migraine has a different treatment and sinusitis has a different treatment. So, for that, the doctor might do an x ray and do your physical examination to find out what kind of headache is it. And sinusitis can be treated really well. So, and another thing about sinusitis is, like when you bend, you feel that something is falling down, and with the movement, it can increase. The pain really go into an intense situation with pain with movement. Now, there is another kind of headache, which is medication overuse headache. Medication overuse headache is most commonly, like, we have a headache and we keep taking painkillers for the headache, and then finally there is no the pain medication does not respond, and you get frequently headache. There is 5% of a headache which is because of the medication overuse headache. So this also means that you should not take a lot of pain medications for headache without understanding what kind of headache is it. Okay. So uh, so they asked, like, how do you understand, is it medication overuse headache? So the one point what we have to understand is, with the medication overuse headache, the pain is worse in the morning, and there's more days of headache than without headache. That's another point to understand, is it medication overuse headache? And the headache is very frequent, like mostly almost every days you will have headache. Okay. I hope you have understood about all these things what I've explained it right now. Now, any questions? Okay. So we have discussed about primary kinds of headache, how to understand secondary kind of, which is very important. I've just mentioned, which you can understand easily. Now, the main point is, how do we know that we need to have a immediate medical care? Okay. Now, when you know the pain is sudden in onset and it's very severe, and it is associated with any kind of neurological symptoms, uh, how yeah, sorry, I have a question here. If we have headache due to stress, how can we cure it? um, Basically, you need to relax yourself. So we know a method of ourselves to be relaxed. For example, we know the fact that the headache is due to stress. Okay, that's what we say, tension headache. Okay, so basically it's all lifestyle management. So we need to have a lot of fluids, we need to have exercise, we need to have our own relaxation techniques, which actually will help us a lot in reducing the episodes of headaches. So once you start doing things what you like, and you know yourself better than anyone else, so you have to find out what makes you stress relieved. So you find out those things and do it regularly. I would say exercise will help a lot to reduce the stress. So you have to go for a regular exercise, walking, cycling, whatever it is, whichever sport activity you like or you are involved in. Maybe even playing football, going for a basketball, whatever it is, and then maintaining a healthy lifestyle. This can actually reduce the amount of medication that you will take just because of a headache as well. So basically, you will start with the pain medications, and then you will bring a lot of change in your lifestyle, which will help to reduce the stress and tension headache for sure. I hope it's clear. Okay. So next, we were discussing about immediate medical care. When do we have to go for an immediate medical care? So, as I mentioned, when your pain is severe and sudden, and it is associated with any kind of neurological symptoms, like you feel that your the movement is less, some kind of weakness, dizziness, it is associated with loss of vision. Suddenly, you feel that there is a blurring of vision. You feel numbness, tingling on your fingers or any part of your body. So, kind of, you feel that your arms is not moving and any part is not moving. Any mental confusion, that you are asked questions and you're not able to respond really well. Maybe any kind of speech difficulties, seizure. Sometime it can be associated with seizures. Any inappropriate behavior. Maybe it is not you who is going through the thing, and you have a friend or you have a family who is going said that I have a headache and is behaving in all these manners. But I've explained it right now. And then blurring of vision, slurring of speech. Then yes, you have to take the patient immediately for a medical care, or you yourself you feel all the symptoms, you need to go to an emergency immediately. It can be related to any kind of vascular disease or stroke or anything. Okay. Another is when you know the headache is very severe and then it is associated with fever, and you feel like a shortness of breath or you feel stiffness in the neck. It can be meningitis or any kind of strong infections. So you need to have a immediate medical care. If there is a headache which is very strong and awakes you in the middle of the night, you need to have a neurological examination and you need to have a medical checkup done. Okay? If the headache is associated with strong nausea and vomiting, you feel like a projectile vomiting as well, you have to have a medical checkup done. You have a history of head injury or fall, and then you have frequent headache, yes, again, you have to have a medical checkup done. Getting a new type of headache, that you have a regular headache kind of headache, like you have a weak kind of headache and you know it's a tension headache, and suddenly you feel the symptoms has really progressed, or you feel that it is associated with nausea, vomiting, or the symptoms has slightly changed, then yes, you have to have a medical checkup done. Maybe your headache has changed into another category and you need medications for that. And yes, if your headache is you're elderly and you're above 55 years of age and you have a strong headache, you need to be seen by a doctor. Uh, Now, when do you need a specialist to be seen, like a neurologist or a specialized doctor to be seen? When the headache is continuous for 2 to 3 weeks, then yes, you have to be seen. And headache keep getting worse, not recovering with medications, yes, you have to see a specialist. Need pain reliever almost all the days. Like for example, you have headache for 2 3 weeks continuous and you have been taking medications regularly every day at least 2 or 3 times, then yes, you need to have a specialist consultation. Headache triggered with exercise. So there is any kind of, maybe there is a vascular, or maybe it is a migraine, maybe it's a sinusitis. So you have to figure it out. Maybe coughing, then bending, strong, any strong physical activity. Now, now, once you're seen by a specialist or a general practitioner or a specialist or any doctor, the doctor might do a few investigations to find out is everything all right, to find out what kind of headache is that. So sometimes even a low vitamin D can trigger headache. Sometimes hemoglobin, low hemoglobin, few vitamins, few medical blood investigations can be done by the doctor. Sometimes there's X-rays, MRI, CT, which the doctor can instruct to be done. We also check for the ESR, CRP, all those things. A regular, this is all mandatory. If you have a headache, this has to be undergone. And now, what kind of treatment can the doctor give, or what should you do? What can you do yourself to be? That was a question which early was asked. So basically, it's all about lifestyle management. You should, as I mentioned earlier as well, good sleep, eat on time, hydrate yourself really well, have a well balanced diet, exercise regularly, which can increase your oxygen perfusion in whole body. And minimize the exposure of triggers. That's what is very important. Like, you don't eat well, you can have a headache, which is most commonly migraine attack. When you're exposed to sun for a long time, when exposed to heat for a long time, you can get a migraine attack. So basically, how to figure out why I have a headache today. So that's why we always ask our patient to have a logbook. So you keep a book. Okay, you get a headache today. You note down, what did you eat today? Did you have your food on time? How many liters of water did you drink? Was you exposed to the sun? And so and so. So you just make a logbook and figure out what is because every migraine patient doesn't have the same triggers. It can differ. So for some people, it might be just looking into the system for a long time. So if you have a screen protector, if you have a glasses, it will be much better. So there's few things which you can actually figure out yourself without a doctor. So you can find out what is the trigger points. So keep a logbook, as I mentioned. Find out what exactly is causing the headache. High blood pressure can cause headache. Definitely, yes. High blood pressure can cause a headache. That's a triggering point. Yes, you have to calm down. You have to take your medications. You need to have a physical examination done. You need to have few blood tests done, and then you have to have a right medication for your blood pressure. Maybe it is your diet, or maybe it is your lack of exercise. So, blood pressure has a strong link to headache. That's true. And Mm, as they asked, like counseling for the stress and tension headache, it can be a lot better, as I mentioned earlier, and with the counseling and stress management, because now these days the psychologist gives a lot of tips and useful helps by saying, like, can do 1, 2, 3, 4 to manage your stress. Giving a small 2, 3 sessions of counseling can help a lot. And definitely medications. If you have a migraine attack, you should take medications before. Like, for example, you should never wait for the peak point to be reached. So you take a medication in ahead, so the headache is not getting worse. And few things which can be done at home, even, like, for example, you can apply some cold packs if the headache is very bad, or you can do some massage and stretching exercises for your back and your back of the neck. That can be done. Taking a walk, maybe just going out for some time, taking a breeze, can also help a lot. So this is, and definitely the doctor will figure out what kind of headache is it. For few headaches, there is a prolonged treatment for 1 month to 3 months even, and after that, you can notice that episodes of headache can be, be very very less, to be very honest. For example, if you have headaches like 10 to 15 days per month, it can go down to 2 or 3 episodes per month. So basically, it is very important that if you have a recurrent strong headache, not better with any kind of tips and remedies or basic pain medications, then yes, you have to be seen by a neurologist or a GP or whatever it is. At least be seen by a doctor so that the basic things can be done and you can be referred. I hope the session was simple and easy to understand. Any questions? Thank you so much for listening and have a great day. Thank you.